Hi guys. Okay, Ariana's going to help me with something. What we're working on right now is we're doing some foundational learning about a review about where the sciatic reflexes are, but specifically we want to build a treatment plan around sciatic problems. And Ariana was just talking to me about some of what's happening with her body, which she's comfortable sharing. And so based on exactly where she knows her injury to be and what's happening, we're going to build a treatment plan using our standard reflexology, which would be this chart back here, the reflexes we already know. But then we're going to build in some advanced reflexes. Okay, so it's really more about the advanced work, but you'll get a really good overview of the whole sciatic nerve and stuff that can happen at the pelvis. Okay, so what you were saying is, where's your injury and what do you know about it?
So between L4 and L5, I have degenerative disc starting because of a fall.
Okay, and you do have sciatic problems related to that? You got pain going down your leg or radiating down the leg?
A little bit.
Okay, so if it's between L4 and L5, what I want to explain first of all about the sciatic nerve is this. The positioning or the way that the sciatic nerve is made or comes together is from L4 to S3, which is down here. So here's L4 and L5. This is the sacrum, which is one bony chunk, a little triangle. It forms the back of the pelvis. But it used to be separate vertebrae and it became fused. So when it became fused, the foramen, the holes that the nerves pass through, they used to be holes like these ones, okay, that the nerves can just pass through from the nerve roots. Those become long peripheral nerves that supply muscles and organs, everything else in the body. But from here, they're no longer separate vertebrae, they're all together, and yet still these foramen exist where the nerves exit. So between L4 and S3, all of these nerve roots, they come together and they form a rope. That ropey nerve is the sciatic nerve, and it runs down the back of the thigh like this. So that's the big nerve that supplies your leg, the sciatic nerve. And the reason why so many people have sciatic nerve problems is because anywhere along this area, this whole region, if there's any one of these nerve roots that's compromised somehow, that can then send pain down the leg, okay? And so when people have back injuries, one of the questions that physios or reflexologists or massage therapists will ask is, do you have pain radiating down the leg? What they're trying to decipher is somehow one of these nerves involved that will lead to the sciatic nerve and trigger pain going down the leg. There's something else that is close to sciatica, it's piriformis syndrome, and it's the big muscle that comes from the inside of the pelvis, and it crosses over here and attaches to the leg bone. So if this piriformis muscle is very tight, it can also squish the sciatic nerve, which is not technically coming from a problem at the root, but it's just being squeezed and it can cause pain radiating down the leg. Sometimes that's also called false sciatic or false sciatica. In any case, for reflexologists, we work all the same things. So here's how we're going to develop a treatment plan. First, we have to find where the reflexes that associate to these body areas exist. And we know for sure that the lumbar spine, we're going to find that from this little bump on the side of the foot. For reflexologists that have been with us, we know that's the navicular process, or T12. Immediately below that reflex for T12 is going to be L1. So we're going to go for the low spine from here down, where the highest point of the medial malleolus crosses the imaginary spine. That's the base of the lumbar spine. So lumbar spine in here as a reflex, immediately onto the sacral spine in here. So specifically, for anything sciatic related, we want to loosen up the lower back onto the sacrum. And then we have 4 different regions for sciatic reflexes. So 4 separate sciatic reflexes. So I'll show them to you on the chart. And they are this. So at the bottom of the heel, the bottom outside part of the heel, you're going to press around until you find a tender reflex. Okay, it could be deep and it can be hard to find, but if it's sensitive, you need to work it. So spend your time finding that one. Then there are 2 that wrap themselves around the hip reflex, the lateral hip reflex, and that's wrapping itself around the lateral malleolus like this. Now these guys, there's a little trick to it, and it's this. Do you want to come over and hold this guy? So here's our bony foot and leg. If you actually, you could C-grip this side of the foot up here. If you want to actually turn the foot like this, side bend it laterally, that will make this valley that is literally the ankle joint, right? So it separates the foot from the leg. Here are the leg bones. So if you put your finger in here, you can move that, just side bend it laterally a little bit, and it squeezes against my finger. You can really find that depression or the valley between the leg and the foot. You want to start searching in through here with your caterpillar and find where it's most tender for your client. So you'll ask, where is it most tender? When your client says, oh, right there, that's where you're going to hook and work on that reflex. You might find several of them if someone has active sciatica, and you might find several points to stop and work when you're doing your rework portion. Working in behind that lateral hip along the sciatic reflex, this is the fibula bone. It's very long and slender. You're going to start at the base of the fibula, but your pressure is going up against it. So you're going to at the back of it. And you want to either caterpillar, or you could use your middle finger, one of your fingers, but you want to press against the fibula. And you can really go quite a distance up here, because the next sciatic reflex is actually up the back of the Achilles tendon. Okay, and that could be anywhere up along the back of the Achilles tendon. So those are your 1, 2, 3 up the Achilles tendon, and 4 base of the calcaneus. Those are your 4 sciatic reflexes specific to sciatica, but you will also work low back. You can work the medial hip in support of the lateral hip. You can also work the shoulders, and we just talked a little bit ago in another video about how that really could go across the whole ball of the foot. Or you can work just the joint as a referral or a helper to the hips. Can you think of any other reflexes you might work in a treatment plan for working sciatica?
Both hips.
So you can work both sides. So even if something's happening on one side, you'll work both. Because obviously you're going to be walking, there's gait that's involved, and where you're putting pressure and protecting. Okay, and then back to the original injury that she was talking about, where this is what's narrowing. It's actually this disc, head of that vertebral body, that's becoming smaller. It's degenerating. Okay, so on this model, there's actually a bulging disc, but anything that happens between the bodies of the vertebrae can narrow this space where the nerve comes out. Okay, so that's called a stenosis, when the space becomes narrower. And so for spinal stenosis, either where the nerve roots exit, or it could be along the spinal column on the inside, but it also could be arthritis. So any little bumps along here, if this is becoming narrower, and there's tiny little arthritic growths of bone, that this becomes a little bit jagged and uneven along here, that could also, with this narrower space, start to compromise the nerve that's coming out. So super, super important for anyone who's got degenerative disc disease or disorder, for this to remain as open as possible, to keep the low back from getting tight, because you want your muscles keying in to holding this together and tight and flattening it even more. This needs to stay loose and open. We want to drop the sacrum down, allowing this to have lots of nice room. We want to free up the nerves via the reflexes, but there's also a few other techniques that we can use in advanced reflexology, and keep the whole nerve structure that forms the sciatic nerve easily moving without being trapped in muscle or at the nerve root area. And that'll keep things as healthy as possible, as long as possible.